Welcome, everybody, to another fantastic episode of Sit Downs with City Lifestyle Vegas Edition. I'm Soleil Ray, your publisher for Red Rock and South Vegas. And I have here today someone very, very special, Dr. Andrew Sheep. He is a veteran and, as the name says, a doctor. And he has been in the community for a long time, and he has decided to launch, about 6 months ago, his own unique concierge medical practice. Welcome, Dr. Andrew Sheep.
Thank you. It's so good to be here.
It's a pleasure to be here. Thank you so much for being a part of our community, being a part of Red Rock City Lifestyle. You are a neighbor who gets the magazine at home, and that's how, we started off our relationship. You are married to a beautiful woman, Gail, and you have 2 beautiful children.
Very true.
So you are an intrinsical part of this community. So tell us a little bit about your history with the Navy and everything else.
So for the past 20 years, I have been doing what's called Medicine 2.0. And Medicine 2.0 is reactive medicine. If you get sick, I take care of you and I make you feel better. I did it for 9 years in the Navy. And then I've been working as an ER doctor here in Las Vegas and in other places the rest of the time. And it's very fulfilling, but at the same time, there's a part that was missing. So many of these people, so many of these patients that I would see, their diseases could have been prevented if someone had intervened 5, 10, 20 years earlier.
Wow.
And within the past year, there's been kind of a paradigm shift in medicine to Medicine 3.0, which is more of a preventative medicine. And it's not so reactive, but it's proactive. And it's getting to a point now where we have the technologies where we can really thrive, and we can actually slow the rate of aging, and we can really, truly live our best lives. So right now, my goal for my patients is not only to add more years to their life, but add more life to their years.
I love it. And the name of your practice says it all, right? Which is?
Outlive Concierge Medicine.
I love that so much. And I saw a piece of news on social media the other day about technology, medical technology, and products that can actually help you not reverse your aging, reverse your aging. Can you talk a little bit about that?
Absolutely, yeah.
I cannot talk about what I read because I would probably say things that are inaccurate, but I remember seeing that and I was fascinated. I'm like, I want that.
Yes. So there have been incredible advancements in the past 10 years or so when it comes to longevity medicine. So for instance, I'll give you a couple examples. Well, the first example doesn't involve technology at all. I prescribe meditation to all of my patients. Why is that? Meditation there's reams of literature showing that it improves your mental state, and it improves your mental health. And for me personally, it's not just physical health, it's mental health, emotional health, social health, and spiritual health. Another example that I have recommended to many of my patients is called red light therapy. You sit in front of a red light for 15 to 20 minutes, and it rejuvenates the mitochondria in your cells. And mitochondria are the little powerhouses in your cells that produces what's called ATP, which is kind of the currency of your cell. So I prescribe red light therapy for their skin. They actually make a goofy-looking hat with red light that really helps with hair loss for both men and women. Yes, and the literature on it is actually really quite striking. And then, a third piece of technology that we have now that we didn't have 10 years ago, there is a blood test that I do for some of my older patients that can look for little snippets of DNA in your blood. It's called a liquid biopsy, and it can help. And it basically screens for over 200 different types of cancers. Wow. So if you have a family history of some type of cancer in your family, we can do this blood test, which I can get for my patients discounted. And it's really specific for around 200 different types of cancer.
My goodness. I would obviously not be able to talk about all this myself. That is so fascinating. So you must spend a lot of your time researching, studying to really know what's new, what can really help people have a longer healthy life.
That's right. Actually, what prompted me to go into this was I read a book called Lifespan by Dr. David Schmidt, who his entire focus of research for the past 30 years is how do we live better lives, especially as older, when we get older. And he's also doing a lot of experiments on what therapeutics can we do to let us live longer. Mm-hmm. So for example, a really easy one that anyone can do is fish oil pills. EPA and DHA within fish oil pills is actually very anti-inflammatory. So there are three main things in your body that happen as you age. You have mitochondrial dysfunction, you have insulin resistance, and you have systemic inflammation. If you do 2 grams of EPA and DHA a day, that really cuts down on systemic inflammation and has actually been shown to decrease the rate of aging.
Really?
Yes.
I'm going to start taking them tomorrow.
Absolutely. Please do if you're not.
Do you have your own line of supplements?
I do not, no.
Yet?
I have no upcharges. I just charge I don't take insurance. I charge a monthly cash fee. Any kind of therapeutic I give to you, any x-ray or ultrasound I order for you, even the blood draw, you pay for that out of your own pocket. I don't want to upsell people. I want to give them the best advice, unbiased by any supplement line I may have.
Oh, very good. I love that philosophy.
Yes.
And let's go back a little bit to meditation, because I personally meditate every single day.
Do you? Excellent.
Yes.
Do you do guided or by yourself?
That was going to be my
okay.
question to you. I started with 20 minutes, then my body asked for 30 minutes, then it asked me for 50 minutes. So now that's what I do. And I started with guided, and then I got tired of the noise. I'm like, it's too much chatter in my brain. So now I actually just focus on my breath, right?
Perfect.
And there are just so many types of meditation: transcendental meditation, guided meditation,
That's right.
open heart meditation,
That's
blah,
right.
blah, blah.
Yeah.
What do you suggest? Any kind of meditation, or do you have a specific one?
I'm going to give away the app that I use and that I prescribe to all my patients. It's the one that has worked the best for me. So for me personally, I have ADHD, an attentive type, pretty severe, which helps me in my ER job, where it's constant interruptions and distractions. However, meditation, I've been doing it really intensely for about the last 6 months. It really helps my ADHD brain. I recommend an app called The Way by Henry Shookman. He is a Zen meditation master. And I send all my patients a link for 30 free sits. And the majority of my patients that I've prescribed it to have really stuck with this app.
Wow.
But however, I just read a study yesterday that the type of meditation with the most medical literature behind it is what's called loving kindness meditation.
Yes. Okay.
And it sounds like that's what you do, maybe?
No, well, that's what I call the open heart meditation, as a loving kindness.
Yeah.
Actually, what I do is just really focusing on my breath. It's the mindfulness meditation.
I got you.
And I did, because I've been meditating on and off since I was 19.
Perfect.
And then since 2018, which is like many years after 19, I've been doing it every day. And I've tried different. And then I stumbled upon mindfulness meditation when I was doing my thesis for my PhD.
Oh, wow.
And anyway, so that's what I like to do now.
And I'm sure it's helped you positively.
Yes, it's so grounding, and it helps me be centered.
Right.
Because I do have slight dyslexia and ADHD as well.
Yeah.
So
many of my patients do
it helps
too.
quiet the brain.
So my philosophy is with any type of medical practice, you need the foundation.
Yeah.
We talk about everything with my patients. We talk about exercise. We talk about diet. We talk about their mental health. We cover everything. And that is probably 60 to 70% of the equation. If you can get that stuff right. Oh, and the other obvious thing is sleep. Sleep is maybe the most important thing. Like the most powerful stimulant there is good sleep. So we make sure that is basically set with everyone. I'm actually partnering with a functional health coach, and those that sign up for a year-long membership, they get 2 included sessions with a functional health coach to make sure their foundation is really set. After that, we work on the structure of the foundation. So, if someone needs GLPs, we can prescribe that. And then we go into a lot of hormone therapy because, when you get your blood tests back, something may be normal for you, but it's probably not optimal. So for instance, a lot of my patients, especially the ones that have indoor jobs, are vitamin D deficient. When I send their vitamin D test, their result is normal, but it's really not optimal because vitamin D is a hormone. It has to do with hormone production, and it has to do with mental health.
Depression, people that are deficient in vitamin D.
Absolutely. And bone health.
Yeah.
So our goal is not to be in a normal vitamin D range, it's to be in an optimal vitamin range.
I love that differentiator.
Yes.
A lot of doctors don't use those terms, and it makes total difference, right?
That's right. Yeah, my goal is for people to feel like they're a superhuman.
Oh, I love that. Yeah. Wow, that is a great goal to have.
And then the third part of my vitality architecture is the apex, the last 10%. If you really, really want to push the envelope and do some kind of cutting edge therapeutics, some senolytics, some nootropics, if you want to get into peptides, things like that. I counsel people like if they want to use psychedelics. Obviously, I don't give them that, but I give them a medical viewpoint of what that could entail. Those for the people that really want to feel like a superhuman.
I love that. And you have power partners then that you can recommend and refer.
I have a lot of referral partners that I work with. I work with a longevity pharmacist, and her interest is really in having good skin, good hair, your hands, things like kind of more aesthetic stuff. Because for me, the aesthetics follows when you feel great.
For sure.
But for people that want to dive deeper into the aesthetics angle, that's not exactly my expertise. I partner with a pharmacist, and that's her expertise. I partner with a functional health coach. And again, if you sign up for a year-long membership, you get complimentary sessions with all these people.
That's amazing. And how long has it taken you to find these power partners?
I'm constantly looking. I'm constantly trialing new places. I partner with a bunch of different compounding pharmacies. One I used had been good, but we are more of a rocky relationship right now, so I'm looking for new. So I've already been talking to new ones this morning. I partner with a shop that does DEXA scans, VO2 max, and resting metabolic rate. And I'm trying to negotiate a lower price for my patients. So what I do is I try and think what I want to do to live well until my 80s and 90s. And I want all my patients to have that same access.
I love that. So you're very determined in contributing to people's longevity.
Absolutely.
And when we met, you were thinking about getting a brick and mortar.
Yes.
And that idea just flew out the window. And tell us why.
So when I have, with all my patients, 95% of them prefer telehealth.
Okay.
They prefer to sit in their pajamas at home and talk to me. And that's fine because, honestly, I would rather do that too. I'd rather sit at home and provide telehealth. We have a really nice telehealth setup. I use a lot of AI in my practice because, people that are anti-AI, the AI really is the future.
Oh my God, I just had this conversation with my previous guest.
Yeah.
She's an architect.
Yeah.
And we were talking about how it's been super intimidating, especially for the younger generations.
Absolutely.
Yeah, but us older people,
Yeah.
right? We embrace it.
Totally, yeah. I mean, I'm an elder millennial, so I'm embracing it. So, for instance, I have an AI scribe. I don't want to be writing notes when I'm talking to you. I want to look at you in the eye when I'm talking to you.
Love that.
And our intake exams take an hour or two, depending on how complex you are. My patients prefer to stay at home for their medical care. So I partner with mobile phlebotomists to get blood drawn at your own place. I partner with mobile radiologists, so x-rays and ultrasounds can be done at your place. I partner with online pharmacies. All their stuff is delivered at their place. Later, probably later this month, I'm adding a new feature to my yearly annual memberships. If you sign up for an annual membership, you get a bag full of supplements and full of prescriptions to just in case something happens. So if you have nausea and you're vomiting, You don't want to have to text me and then I'll call in a prescription to the pharmacy and you have to go there. I'm going to hand you a bag with all those prescriptions in it with a laminated paper explaining when to take all that stuff. That's what my patients prefer.
That is like something that really sets you apart. And that makes you be proactive in every sense of the word, proactive.
That's right. Yeah. I call it my tactical med kit because,
I
I was in the
love that.
Navy, so it's going to have a little bit of a military flair to it.
I love that, Dr.
Yeah,
Sheep. That's
thank you.
amazing.
Yeah.
And I had no idea that we had access to mobile phlebotomists, mobile imaging. I had no idea.
Yeah. My goal in mind is people that really want to invest in their own health, because my philosophy is with good health at the base, everything else in life is better.
As within, as without, right? That
Exactly.
is the philosophy.
100%. So I want people that are really, really motivated to become healthy and but that are disciplined, that are going to work on their exercise plans. They're going to work on their diet. Most importantly, they're going to work on their sleep. I love Las Vegas, but it is not a good city for sleep. I wrote a blog post on my webpage called The Las Vegas Tax. And the Las Vegas Tax is in such a city of nightlife, hard chargers, that takes a toll on your epigenome, on the software that runs your body. I want to meet up with my patients and strategize how we can minimize that Las Vegas tax.
I love that. This is amazing work.
Thank you.
I'm so glad to know you and that we partnered up to, let the community know that you are here to improve everybody's lives. And you are in our June issue, and so people can learn more about you and your why and, a little bit more of your personality, because this has been incredible. A plethora of knowledge and wisdom and experience. And how can people get in touch with you? So
my website is www.outliveconciergemedicine.com. If you want to email me, my email is drsheep@outliveconciergemedicine.com. And on the webpage is my phone number. By the way, with my practice, I'm available to all my patients from 7 a.m. to 9 p.m. every single day. I'm very responsive. If you text me, I'll get back to you within 15 minutes at the very latest. Also, I said I have no upsells. That's kind of a lie. I do home visits.
Oh, okay.
Some of my older patients that live near me, they want to see me every month, so I go over every month. They want me to bring my wife and my kids because they have a pool, so we do that.
Oh, that's amazing.
But they just want to be seen in their home, and a lot of my patients, if they do want me to see them in person, I'll come to their home. But it just depends on how far away you live.
So you're bringing back that home doctor visit too.
I am.
Wow, I love how we are going, not backwards, but we're going so old school in so many things.
That's right.
Because it's important to, especially nowadays with the fast pace and older people, to have that flexibility and that convenience.
That's right. I've been working on a book for the last 5 years. It's almost done.
Okay.
I'm just working on the citations now. It's called The Future of Health. And it's really, I've spent a lot of time daydreaming, night dreaming about what healthcare is going to look like in the future. Because take it from me, someone who's worked in ERs for 20 years, our current system is completely broken. And I think what I'm doing and some of my colleagues are doing is really breaking, kind of shifting the paradigm as to what healthcare can be, more preventative care, more care to make you feel better, and just to increase human thriving, basically.
I love that so much. Well, thank you so much for being here today, for sharing your wisdom, your passion. You're super passionate about what you do, and that makes a difference, right? And how we treat people, how we do our job, how we wake up in the morning. And I've also heard you're a rock climber, but we're not going to get into that today. We'll talk about that another time.
Okay, that sounds great.
Thanks so much, Dr.
Thank you. I appreciate it, Camilla.
Thank you. Thank you so much for watching this incredible episode with Dr. Andrew Sheep, the best concierge doctor here in town. Please like, share, and subscribe this episode. You never know who can benefit from this wonderful professional. See you next time.